Hi guys, Sunny Yeager here. I will be discussing my presentation on concepts of assessment. So the purpose of this presentation is to categorize, classify, and showcase a few assessment methods. I will be providing insight on how concepts of assessment correlate to Miller's framework. And my goal for you is to correlate these concepts in an organized manner so that you're able to drive learning for your learners in a desirable direction that can foster deep learning approaches. The ACGME and American Board of Specialties collaborated on an outcome project which mandates that residency training programs document and assess their learners. Assessments are best implemented when trying to assess the educational outputs of Miller's framework, along with Kirkpatrick's standards for evaluating the effectiveness of training. The purpose of your assessment will guide the type of output you're interested in assessing for the means of pass-fail, formative feedback, or high-stakes testing. There are various types of concepts as seen here, but I will be focusing on performance, observational, and oral examinations. These assessments fall under the constructs of clinical competence and workplace assessment. Performance tests assess clinical competence, and the Hawthorne effect can be elicited here because learners represent their maximum performance due to the fact that they know they're being observed. Some methods utilized for this type of test are OSCEs, scuba diving certifications, and driver's tests, all of which measure the educational outputs of shows. Other types of assessment include workplace assessments, which can be delineated by oral exams that use methods such as chart-stimulated recall to showcase the educational output of shows and does. Observational assessment use methods of a mini clinical examination exercise, 360-degree feedback, and direct observation of procedure skills. These educational outputs transcend through Miller and Kirkpatrick's framework, which assess the developmental increase in students' clinical knowledge, skill, patient care disposition, and professionalism as a result of instruction experience. Here's a table of advantages and disadvantages of the types of assessments I discussed. It is important to note that the lack of meaningfulness during assessment leads to trivialization, a serious and frequent hazard of assessment. For example, if learners are required to memorize checklists for passing an OSCE but have no connection with patients, their performance is trivial. Assessments build on various theories. Educators are provided the opportunity to observe participants in action as they respond to complex challenges. Constructivism is a leading theory with the notion that knowledge involves the co-construction of experience gained and its capacity to manage the complexity proposed by patients. Bandura's social learning theory posits that people learn from one another. It is a bridge between behaviorism and cognitive learning theories because it encompasses attention, memory, and motivation. The research evidence is clear that high-fidelity medical simulations facilitate learning among trainees when used under the right conditions. These 10 conditions represent an ideal set of educational circumstances, and the evidence also shows that this educational platform complements but does not duplicate education involving real patient care. Skill acquisition from simulated practice, assessment, and feedback boosts learner self-confidence, perseverance, along with effective educational outcomes that accompany clinical competence. This is the big picture. Here you can see the differentiating instructional methods delineated here by the different shapes, along with incorporating the methods of assessment, which provides feedback, which should drive self-regulated learning. By providing different methods of assessment, it gives you a better picture, or it provides a better picture of the competence of learners as they progress throughout their curriculum, all the way to mastery. Oh, sorry about that. When determining a purpose, like I had stated before, purpose guides the data that you're trying to collect. And it is important to start with, or is it ideal to start with a backward design that Wiggins proposed. And you're always trying to think with the end in mind. The types of depending on the purpose, you're going to pick the type of method, which then goes into utilizing different modalities, which include SIM, standardized patients, in a clinical setting, in a unit, or other opportunities. When collecting data and interpreting it, it also addresses the factors that include if the tool is properly assessing all the expectations of good clinical practice and competencies, if it identifies areas of improvement, and if it's willing to distinguish standards including competent or non-competent learners. Some factors that are included in data interpretation include validity and reliability. Reliability has to do with if the type of modality that is provided can be reproduced to aggregate data in order to interpret it. Sorry about that. So in validity, it has to do with if a test is measuring what it's supposed to measure. There are some common misconceptions about validity. The property about validity is not in the assessment tool itself, but the aggregation of data collected through the instrument. Things that affect reliability and validity are systematic or random errors. Systematic errors include if a tool is unclear with its instructions, or, for example, a random error could be if an evaluator is sleep deprived while evaluating a trainee. Consequently, this affects the reliability of scores, which in turn lowers the validity of an assessment. The results complete the circle of assessment, planning, and instruction by providing teacher and students evidence of learning. Feedback allows for movement of the learner's zone of proximal development. And self-regulating is an active process where the learner attains and satisfies their desire to be independent in their learning. In conclusion, there are various concepts of assessment to regularly check students' understanding in order to arrive at a robust decision about their progress. Just like a two-way street, it also provides the opportunity for educators to reflect and determine if our instructional interventions, modification, accommodations are conducive to fostering deep learning that impacts future learning as well as future patient-centered care.